Topic is ram's horn penis. Hello dear students, we'll discuss a activity which is seen in the scrotum. Just see how exactly it looks like, what this condition is. See that this is bent like this. Scrotal also there is edema here, like this penis is bent like that. This is ram's horn penis. Commonly due to filariasis or sexual transmitted diseases like lymphocytic venereum, or for some sort of infection, or after inguinal node surgery like inguinal block dissection, rarely it can be idiopathic. It is called as ram's horn, or saxophone penis also, another name. It resembles horn of a ram. The deformity and curvature of a penis along its longitude like this. It bends like this with edema. Often calamine lotion local application helps very well and treat the cause. With block dissection, other infection if you cause, treat, and local application calamine and anti-inflammatory analgesic will control the condition. It's a ram's horn. Now exactly this is being it's being compared. And evaluation etiology mainly important. Filariasis, treat that. Malignancy, LGV, mainly drugs. DEC may be helpful. Diethyl carbamazine citrate 100 mg 3 times a day for 21 days. Reduction surgery with the reconstruction may be needed eventually. Local application like calamine lotion also very helpful. Magnesium sulfate application also will be helpful. Antibiotic, anti-inflammatory. Then if it persists, it becomes more and more, may have to do a reduction surgery by plastic surgeon. This is the typical ram's horn penis, otherwise called a saxophone penis. To answer the question, MCQ, Tiver-Travis syndrome is aggressive non-Hodgkin lymphoma, aggressive Burkitt's lymphoma, lymphangiosarcoma and chronic lymphedema, fibrosarcoma and chronic lymphedema. So find out the right answer and put it in the comment box. I will give the answer later. Students, please. Scrotal edema treated usually by conservative treatment, multiple incisions, incision and drainage, protectomy. Again, find out the answer. Put it in the comment box. I will get you back. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics including briefly trauma, how to approach orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing clinical method with a lot of photos, illustrations, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis. But it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail. Principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics, general surgery, endocrine surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with the illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there. Covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast and other things, include briefly gynecology surgeries, with step-by-step illustration photos, more than 10,000 photos and illustrations are, and which covers everything. For to learner, you can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that in detail. Explanations are there. My small atlas of tissue approximation with the videos shows clearly with the principles how to suture tissues. Dissection and tissue approximation, there are two parts in surgery. Dissection is a principle, essential. After this surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that very useful thing to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website both in YouTube, Instagram and so on. My DigiNow lectures to the JP publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topics, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspects, surgical principle, operative surgeries, examination, clinical exams, videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It gives detailed thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books with including DigiNow and lectures. Thank you very much. So students, I hope you have understood this ram's horn penis, saxophone penis very well. Thank you so much.